I'm about to go into the office of Dr. Mc Intosh to have a conversation with her about some of the things taking place here at the St. George's Hospital. She's hopefully going to clear up for us some of the things that are taking place. And let's go in and talk to Dr. Mc Intosh. She is the new, she's celebrating 1 year as the Director of Hospital Services here at the St. George's Hospital. She herself is an OBGYN, trained, proficient, qualified, and they've put her in charge of the hospital, and then she's, you know, the lady with the whip. And let's take a look, listen, and a look. Today is really the first week of January, I think, right? The first week of January, and I'm sitting in the office of the Director of Hospital Services, St. George's Hospital, Grenada, and I'm talking to the director. My name is Mc Intosh in the picture right now. This morning was scheduled an interview with her, but an emergency came in overnight, and the whole place is not in total disarray, but it's in emergency mode. Dr. Mc Intosh, tell me, give us a picture as to what we're dealing with this morning.
All right, good morning. Good morning, Mr. John Crow, and as well, Happy New Year to you, and always a pleasure. I apologize for the fact that we're not able to do an interview to really talk about a lot about the hospital services on a brief note. But today, this morning, actually at 5 a.m., there was a fire that occurred in St. George's town proper. And the fire was extreme, and the fire department required that the electrical system to the building that was on fire be turned off. That in turn had Grenada turn off the electrical systems, and that included, unfortunately, the general hospital, which alerted us with the system going down. We had to manage within that of not having electrical supply to the hospital, and how do we manage through in making sure that everything and patients were safe. This is an ongoing process. We confirmed that everyone was safe, that no casualties occurred, no problems. In addition, at the fire itself, there were no casualties that required hospitalization or medical care. We then all met up, which I thought was a very good thing, was the Commissioner of Police decided to call a meeting of all the stakeholders, which included fire, police, Grenada, and hospital services or medical services. And at that point, we all discussed how we move forward with this when there's a major emergency that is not disaster, but is an emergency that affects people. And how do we make sure that we maintain people's safety and people's health? I think there are going to be very good protocols that come from that, and very happy to be a part of that particular system, and understanding that here at the hospital or in hospital services or Ministry of Health in particular, it is our duty and our wish to make sure that we maintain the best of care that we can with the resources that we have.
Now, in this moment, I know your head is not there, but I know that the hospital has been under a lot of criticisms, right? Take a minute and if you will dispel some of those myths that are out there that folks are talking about and painting this negative picture of the hospital.
Right. So one of the things we have to step back and understand that Grenada, Carriacou, PT Martinique is a third world country. I hate to say third world because we're all in the same world. But when you designate it as a WHO, World Health Organization, it's designated as a low to middle resource country. United States is a first world country, which is high resource, no question about what it has present. And I think that we need to always step back and recognize that we cannot compare the two. The saying that you cannot compare apples and oranges works here. It's not even apples and oranges. You cannot compare apples and peas. Like it's not even the same category for comparison to even consider. And that's one of the things we need to recognize. And we need to recognize that we are providing services to 100,000 people with one hospital, with minimal resources that are there to not only be just for medical, but it's for medical, for health, for education, for the infrastructure, for employment, for et cetera, et cetera, et cetera. And for me, who is coming from being born and raised and trained and working in a first world country, I say we're doing the best that we can with what little we have. And recognizing that we do have shortcomings. But we need to also recognize that when we have the shortcomings, it is not for us to criticize, but for us to look at that and say, how do we manage with the shortcomings? One of the different things, one major thing that came up is that people were talking about and sending pictures out and saying there were so many people on maternity, people were in the halls, people were on the floors, sleeping on the floors. Yes, that happened, but people need to ask, well, why did that happen? That was the thing, and I had no problem with that because we had 44 patients that were in-house that delivered, all safely, within a week's process. Okay. But that over that period, we have a maternity ward that it was bedded for 18 and has within the maternity ward a special care unit for our preemie babies that manages. We have a special care unit, preemie babies, meaning that even though we say we can take care of 28 weekers, we have been able to maintain, sustain, and have viable 24 weekers, which is something that's remarkable. So when you're talking about 44 people in-house delivering, it is necessary because they cannot deliver outside because obstetrician is right there. If there's any need for emergency C-section or the need for an obstetrician, this is where they need to be. So yes, that is the case. But what happened during that particular week was we also had an oncologist that was on site who was here to take care of our patients. It was a G1 oncologist, take care of our patients with malignancies. He had surgeries of 16 plus that needed to occur. So now we have the two wards where normally our spillover from OB would go into GYN. It could not because we were filled with 16 plus patients for surgery, post-surgery, and who are having, and other patients that were there as well. So we were maximally filled. It is, yes, take the picture and show that there's so many people in there, but a picture is not something without the story. That picture showed that for one hospital that is small, was able to manage to do deliveries and healthy babies and babies that survived, that the hospital was able to provide a service to provide for patients who had cancer and the G1 oncologists, well known from DC, come in to provide those services without charge to the patients and be able to follow up on patients who had previous surgery. And all of this being done with the fact that we are woefully understaffed with nurses, woefully understaffed even with our physicians, but people did well. And when you talk to the patients who had cancer and had the surgery and said, thank you, we were in-house, the nurses and doctors were there helping me through, I was able to have my surgery, I came through it, and I'm good. That is something to be said. If you ask the person who was laying in the bed in the hall, she would say, yes, I had my baby. It is hard. There's a curtain that's up, but the nurse was good and my baby's well. So we do have that. And me being an obstetrician gynecologist, I remember during my residency and even now at St. Luke's Roosevelt, Midtown Manhattan, right there up on 59th Street, on the west side in uptown Harlem, there are days when you walk on labor and delivery, even though you may have 18 labor rooms, patients laboring in the halls because of the amount of people. That does not take away from the care, does not detract from the care. It just says that how much more we need of care. What that said is that the general hospital, which has to provide for all of the people, we need more help. We need to be able to provide more services out in the community. But for us to be able to do that, we need more nurses. We need the doctors. We need the resources to build the services out in the community and sustain it. And so we need to look at that and not necessarily criticize, but talk about how much better we can do. We need to do better.
What can we do to help?
And what can we do to help?
And what can we do to help?
What can we do to help? It is the support of, and I'm not saying monetary because money's coming in, goes into our general system. Doesn't mean that it goes into someone's pocket, and I don't want people to say that, and that's why I say these things right up front, because people say, oh, general system pocket. No, it goes into the general system. We need actual supplies, but not just any supplies. We need supplies, and we have a donation table, which is under my care, of where we're saying these are the particular supplies we need. Right now, we need hospital beds. Hospital beds with the front and back and the rails. Doesn't necessarily have to be electrical powered, but being able to lift up the forward, head, and back. And you may say, well, I don't know which hospital bed. That's fine. We're trying to do a whole thing where you can say, I can give you money towards a hospital bed. That'll be great. We need hospital-based sustained mattresses for the hospital beds. We can't get it from Siemens, because that's not the mattress we need in-house, but a particular type. Well, a quartz, right. We need even the smaller things. And people may think that that's not much, but we need shower curtains to help. And you say, why? Well, we do. Because even though we get it and we try and get it, if we don't have all the resources, some of those different smaller amenities, which will make a person feel that much better, are necessary. But that's not a high priority for us, is to get a shower curtain. A high priority is to try to get the pulse oximeters that are stable. We need nebulizers, but hospital-based. So it is to ask us, what is it that you need? And we will say, well, these are the type that we would need, and we appreciate. But even if you want to give, even if you say, well, I'm not going to ask, I'm going to send this, that can be helpful, because sometimes we can send it out into community, because some of our patients, when they have to go out, may need these services, and we'll have that ready for them.
Is there a phone number that folks can reach out to, or an email address, or anything like that?
Yes, they are able to reach me if they want to. I'm on WhatsApp at 1-473-534-5100. That's 473-534-5100. Or they can actually email, and my email is D as in dog, H as in Harry, S as in Sam, at health.gov as in Victor.gd. So DHS at health.gov.gd, Direct Hospital Services initials. So we welcome it, and we welcome this. We welcome communication. We are working on so many different things, and yes, we have our downfalls. Yes, there are times when people come in and they're saying the bedside manner is not good. That's true. We do have that. We're working on it. And we have people that the bedside manner is fantastic. But people come in and that's expected, so you don't hear about that. So we welcome just giving a pat to some of the nurses, because they're working hard. The doctors working hard with what resources we have, what little resources we have, we're doing it. And I have to say, I talk about peds, that's something. Talk about neurosurgery, that is another thing, where we're able to provide the service to patients who've had strokes, bleeds, to stop the bleeds and help them to manage that, which we at times were not able to do in the past. Brain tumors, we're able to manage that here. That is remarkable. We don't have to send them overseas for the care. Cardiology, we're working towards that. We're working towards getting in additional services, but with that needs the staff to manage that. Emergency medical services, yes, people talk about the lack of the ambulance. We're working on that, and we recognize there are times when you call for an ambulance and there may be difficulty or a delay. Ask why that would happen, so that it will help to alert all of us. And it's not as a criticism, but come to the authorities and say it, to allow us to go back and look at it and see how we can improve upon it. But I say, just as we post the negative, let us also post the positive. Let us talk about that 24-weeker whose mother and father are saying, oh my God, did my baby survive? Whose baby survived, and a year later, that child's running up and down. Ask and post that. Exactly. Because you never know, that may be the child that's going to become
the next director of the hospital.
Exactly. And be able to do so much more, or become a Steve Jobs, make a whole lot of money and bring it into Grenada and say, improve the hospital. There's so much. And we have people that are helping, as yourself, spreading the information, making the communication, knowing that when you come to Grenada, you're coming to Grenada. Don't come expecting, and I'd say this, if you live in Brooklyn, don't be coming expecting that you got a Memorial Sloan Kettering, that you got a New York hospital, that you have a downstate, that you have a Mount Sinai.
Choices.
You don't have choices.
Right.
So that if we don't have the choices, understand that that's what's present.
What's happening with Carriacou and Prince Valley?
Well, Carriacou, Carriacou and Petit Martinique are to my heart.
Right.
So with Carriacou and Petit Martinique, we're pushing. Ms. McLawrence, who's the health administrator, Sister Hamlet, and Dr. Davis are all working to say how to improve upon the medical services there. And we're incorporating them as well to make sure that we're improving. And they've had some construction done at the Princess Royal Hospital to help to improve. And it's really, Princess Royal in Carriacou.
That's right.
Yes,
Princess Royal
in Carriacou.
Princess Alice is in
In St.
Right,
Andrews.
right.
And what we're able to do is being able to provide the services even more so to be able to, what we're trying to work towards is having to be able to provide more services in Carriacou so people don't have to travel across. So that's one thing that's good and is working towards that. They now have 3 doctors present within the hospital system, which is very good in Carriacou. And then we have Princess Alice Hospital, which is up in St. Andrews, and we're working towards making that a full-blown hospital as well, working towards bringing up the services that are here at the General Hospital, which will take some of the load off of the General Hospital, bring it up into that particular area, and allow for it to be able to reach out to more people. It's slow, but it's steady.
It's moving.
It's moving. And, I have like my basic statement of let go of what didn't happen and embrace what can happen. We need to let go of what didn't happen. Oh, that person wasn't nice to me. Or I didn't get the ambulance. Or this is let go. Embrace what can happen and say we can do that. And my base is that we give the resources to the doctors and nurses that we're asking to give better health care. Let us help give them more resources to be able to do so. So it's a new year. It's a new decade. God is good. He really is present. So I hope that we are working towards that. And even though and I have to say thank you because I was like, no, I can't do this interview. But just stopping being able to talk about it has given me the spurt to go back and say, let me get going again. Yes. Thank you.
I thank you. I thank you for this time. I thank you for this time. I thank you for this time.
Happy New Year.
That was Dr. Carol Mc Intosh here in Grenada. She's the director of the hospital services at the General Hospital in St. George's and covering the hospitals of Grenada, Carriacou and Petite Martinique, Princess Royal in Carriacou, and Princess Alice in St. Andrew.
Which is the second largest hospital in Grenada, which is the psychiatric hospital, which we need to be aware that is one of our main posts, to start making people be aware of mental illness and mental health here in Grenada, and recognizing that too is a hospital that needs to be addressed as well.
And psychiatric is a big word for, we call them crazy.
Well, don't call them crazy. No, we call them mentally ill. Okay. That is another disease, just as somebody has diabetes or hypertension. This is another disease that happens. Yes, it's in the brain. It is not something that's strange or crazy or anything along that side. This is an organ which is one of the most strongest organs in the body that has a defect that needs help. Okay. So those who have depression, those who have schizophrenia, those who have drug addiction, those who are older who start to have signs of Alzheimer or dementia can be treated and managed. We need to recognize that openly and see how we can help.
I have to say crazy because then you will bring in the clinical language.
Yes.
So that for those of us who think, well, once you go to the mental institution, then something is wrong with you, and or something is wrong with me, and then I cannot be helped.
Which is not true.
Which is not true.
Which is not true. And we should not be ashamed of saying, yes, I have depression, but I'm going to be getting treated. Because remember when we had the whole thing where a village raises a child, or just stop and think about postpartum depression. It is more on the rampage, especially in the United States as well, because of the smaller family. In the past, it used to be the one woman has a child, grandmother, a mother, everyone is there to assist, so that she has a chance to recover from all of this and take it on. Now it's times where it's all on her, and sometimes even more so postpartum depression comes in. In the past, they would pick that up and say, okay, we'll take care of the child, you sit and get better. Here, there's no one there, and it's there, and then she has to hide it because no one's sitting there to say, do you need help? Are you sad? And it's okay, we're going to be here. So even with that, and then bipolar disease, manic depressive, it is a hard thing to be even here. That happens, and it's very real. It is not someone put this on me. It is not any of that.
Somebody do me.
Somebody do me. Somebody put, no.
And then put something in the yard.
No.
And I step in it.
Right. Yes. No. I can manage through.
Right.
Or drug addiction. We have to recognize that these things are there. Right. And if we recognize it and put it in the same place as, oh, I have diabetes, I need to treat it. Oh, I have depression, I need to treat it. There are a lot of people that have these diseases and are very much giving in the world and doing a lot. And there's this old stating that says the line between illness or craziness and brilliance is a fine line. It's a very thin line. So that person that you see, Albert Einstein, you talk about people with autism, they have special skills that are there. So the brain it's fascinating. It's not well developed, but we know that we can talk about it.
Any kind of community outreach, community training along the lines of people who have mental issues going?
See, there's so many different things. So we want to start. That's one of our different things. Mr. Kester Cyrus, who's the hospital administrator for Mount Gay, often talks about it. We need to start to recognize it, and even just pulling in the people in the hospitals to make them aware, and those that who we are in servicing. So we're working on that. We have not had it fully. If someone is saying that I would like to be able to assist, we welcome that. We redeveloped the pastoral care team here, and that means all the various types of clergy from the various faiths are on call to come in to assist at times if someone has bereavement, etc. So it's not saying that that's an illness to be in grief, but it may step over into that, and they can help with the counseling. So we're starting slowly. It's baby steps to move towards that, to even recognize to have the medications available to help people who have schizophrenia or depression, and to help to educate the population that you need to take your medication. Just as we're saying you need to take your medication for diabetes and high blood pressure, you need to take your medication for depression. Just because you feel better doesn't mean you stop. And just that basic thing. And I think part of the education is being able to say it openly. Mental health care is the same as other types of care. They're all in the same field. Once we recognize that, that's a big step, because then people won't hide from it. All right. Mr. John Crow, thank you very much.
This is John Crow. I'm at the General Hospital in Grenada, and we just completed a conversation with Dr. Carol McIntosh. She is the administrator, director of hospital services here at the St. George's Hospital. On a day where we had what will be considered a major fire, and so that they were thrown into emergency management mode very early this morning because of the fire. No one was hurt physically. The fire department took care of business quite rapidly. They were able to, they had to, for safety purposes, had to shut down electrical power, etc., because it happened directly in St. George's, and the hospital is part of that. And so the emergency generators and those kind of things had to be kicked in order to the hospital could continue, and safety of the hospital, etc. There are several projects, as you will see, that are being worked on as we speak. Right now, that the hospital is, there are a lot of rumors, and as I hope that you get clear from her, a picture of some of the things that are being worked on, that are being put in place, that are being developed in terms of bringing a better product to the patient, to the families, etc. Many of us would hear rumors, and we would run with the rumors as opposed to finding out the facts as to what are the things that are happening. I made it a point to make sure that I get this confirmation or this conversation with Dr. McIntosh, so as to give a clearer picture as to some of the things that are taking place here at the hospital. She's moved in. This is her actually 1 year since she took over hospital services, and there are some changes that have been made since she's gotten here, and there are some more changes that will be made as time goes by, and all in the name of bringing a better product, a better service to the community. From Caribbean Classroom in St. George's, my name is John Crow.